spread. There's three main mechanisms: invasion, seeding, and metastasis. Invasion is a local spread, and this is direct invasion into neighboring tissues. Cancer cells can secrete lytic enzymes and toxins that break down neighboring tissue, allowing those cells to invade that area. Seeding of cancer cells into a body cell or body cavity. This is where cells break off from a primary tumor and they travel along a serous body membrane to invade the body cavities. This is most common in ovarian cancer, where cells of the ovarian cancer break off, travel along the peritoneal membrane, and then that can cause the development of secondary tumors inside the abdominal cavity. Metastasis is spread to distant organs via the blood or lymph. Okay, and there's some slides that go over that in a little more detail. You can review. Okay, so let's talk about the etiology of cancer. So etiology is the process, or the etiology of cancer is a process by which normal cells get transformed into cancer cells. It is thought that cancer is a multifactorial disease. We have genetic and molecular mechanisms that lead to the transformation of normal cells into cancer cells. And various factors such as age and heredity and environmental agents that cause some of those changes. Some cancers have well-established risk factors, for instance, lung cancer and smoking, but many others do not. Okay, so let's talk about proto-oncogenes. Proto-oncogenes are normal genes that code for normal proteins that are used in cell division, things like growth factors, receptors for growth factors. Oncogenes are mutated proto-oncogenes. So we take a proto-oncogene that is involved in coding for normal proteins that are involved in regulating growth. And an oncogene is when that proto-oncogene gets mutated, and it causes that to produce a protein that in excess, or an abnormal protein, or a protein that can turn on by itself, or is made when it's not needed, or it could cause the production of a protein that would be normally made by a different cell. Now, oncogenes can lead to cancer by turning that abnormal cell growth on. Tumor suppressor genes are genes that code for proteins that are involved in DNA repair or are cell cycle repressors, such as p53. And these proteins, remember, are going to help to keep most mutations into developing into cancer. Now, if tumor suppressor genes get mutated, if we knock out both genes, then their loss of function will allow cancer to develop unchecked. Caretaker genes are DNA repair genes. These encode for proteins that are involved in repairing damaged DNA. So, for instance, if we get a damaged proto-oncogene that gets turned into an oncogene, DNA repair genes can produce proteins that can correct that error. Okay, I've provided a link here that gives an analogy of a car with too much acceleration and no brakes that will help you to understand the role of oncogenes, tumor suppressor genes, and DNA repair genes. Okay, so what are some of the genetic events that can lead to the formation of an oncogene? We can have a point mutation, which is a single nucleotide base change, chromosomal translocation, where we have a chromosome translocated from a normal position to another position within the DNA, or we could have gene amplification, in which we have multiple copies of genes that can cause overexpression of proteins involved in cell proliferation. Okay, usually these genetic events require homozygous deletion, inactivation, or silencing of both the maternal and the paternal genes. P53, we've talked about it a lot. This is called the guardian of the genome. And it is the most common target for genetic alterations in human cancers. In other words, we see this type of mutation in almost all types of cancers. Retinoblastoma gene, this is another tumor suppressor gene that when non-functional can result in retinoblastoma. And there's two forms of this. The familiar form is where persons carry one mutant gene. So all the somatic cells, or the body cells, are normal, but they carry increased risk for developing cancer if that other allele gets knocked out. And then the sporadic form is a genetic form, where both mutations occur after birth. Other mechanisms involve a change in gene expression without a change in DNA, and this can occur through gene silencing or through post-transcriptional modification. Okay, so what are the stages in developing cancer? So we have a normal somatic cell. We get exposed to a carcinogenic agent, and the DNA gets damaged. Now we do have DNA repair genes that can repair that, and we can go back to a normal cell. But if we have failure of the DNA to get repaired, then this can cause activation of growth-promoting oncogenes. It can lead to inactivation of those tumor suppressor genes, such as p53, or alterations of genes that control apoptosis. When these things occur, then this can lead to unregulated cell growth and differentiation, and that can lead to malignant cancer, malignant neoplasm. Now, it's important to point out that a single gene mutation is not enough to transform normal cells into cancer cells, but we need activation and inactivation of multiple genes that ultimately leads to the unregulated cell differentiation and growth and development of that cancer. So what are some of the host factors that lead to the development of cancer? One is hereditary. Now it's important to note that mutations in somatic cells are not passed down to their offspring. Okay? Mutations of somatic cells occur during your lifetime. However, a mutation in a germline cell, and that would be egg or sperm cells, can be inherited. So if you inherit an oncogene or a mutated tumor suppressor gene or a mutated DNA repair gene, that can lead to a predisposition to cancer. So in this scenario, we have, for example, we say we have a oncogene in this egg here, and not in the sperm. And then in the fertilized egg, we have one allele from the maternal side has a genetic mutation. Well, then that gets to the offspring's somatic cells. Each of them, one allele, will have this mutation. Now that's going to make those cells all more susceptible to develop cancer, because if we get a mutation in the other allele, then we're essentially knocking that out. So additional mutations within the offspring somatic cells are usually required to develop cancer. BRCA1 and BRCA2 are mutations, are genetic mutations that can increase the likelihood of developing breast cancer. Inactivation of the retinoblastoma gene also increases the likelihood of developing cancer, particular type retinoblastoma. And in fact, carriers of that mutant gene have about a 10,000 fold increase in developing retinoblastoma. There's also a gene for polyps of the colon that can predispose you, make you more at risk for developing colon cancer. Some other host factors, hormones can increase cell division in malignant cells that are hormone responsive. Estrogens and endometrial, breast and ovarian cancer, androgens, and prostate and testicular cancer. Obesity also is shown to perhaps increase the development of cancer. There's a link between insulin resistance, increased production of insulin, and the development of cancer. Obesity has also been shown to increase the levels of androgens and estrogens, and obesity is linked to chronic inflammation, and inflammation is an irritant that can lead to ultimately lead to the development of cancer. There's immunological mechanisms. So if we have an impairment or decline in our immune system capacity caused by, say, immunodeficiency or immunodeficient drugs, aging, with aging, we see a decline in immune system function. So as we age, we get increased risk of developing cancer. Chronic inflammation seems to increase the promotion of mutations, and seems to cause a decreased response to DNA damage. There's also chemical carcinogens in the environment. Chemical carcinogens are agents capable of causing cancer. These include compounds found in the cooking of fat and meats and proteins, nitrates in smoked or salted food. Colon cancer has been linked to high fat intake, low fiber, cigarette smoke, of course, alcohol, heavy alcohol consumption, air pollution, occupational exposure. Of course, radiation, sunlight, obviously cause of skin cancer, X-rays, and of course we see a much increased incidence in cancer in atomic bomb survivors. Other things, viruses. There's some viruses that are involved in, implicated in cancer. Hepatitis B and C viruses that can cause chronic hepatitis, can also lead to liver cancer. Epstein-Barr is associated with several cancers. HPV is associated with cervical cancer. And then also we have bacterial cause of cancer, H. pylori, which is associated with chronic infections and can lead to the development of various gastric cancers. Okay, moving on to diagnosis, manifestations, and treating. We're going to talk about grading and staging. So grading involves looking through a microscope at the individual cancer cells to determine the level of differentiation. With grade 1, these are well differentiated. Grade 4 are undifferentiated or anaplastic. So as we increase in grade number, the cells become less differentiated and more likely to be malignant. Staging measures the extent and spread of cancer. There's many different methods for staging. T and M is probably the most common method. T stands for the primary tumor and has to do with the size and extent of this primary tumor. T0, you can't even find it, and then increasing in numbers based on the size and extent of that primary tumor. N stands for regional lymph nodes, so how many nearby lymph nodes are affected that have cancer. So N0, no cancer, and then N1, 2, 3, number of nearby lymph nodes that have cancer. And then M stands for metastasis. M0, there's no metastasis. M1, the cancer has metastasized or spread. Okay, you should review local and regional manifestations of cancer. And then we're going to talk a little bit about systemic manifestations. Anemia is due to blood loss, iron deficiency, excessive hemolysis, or impaired erythrocyte production. Invasion of bone marrow, and also cancer treatment. Cancer's treatment suppresses the bone marrow. Leukopenia and thrombocytopenia. This also can be caused by cancer treatment. Also invasion of the bone marrow by a tumor. Systemic manifestations of cancer. Anorexia cachexia syndrome. This is the most common manifestation of cancer. And this is a combination of symptoms including weight loss and severe muscle wasting, weakness, and anorexia. Fatigue and sleep disorders. These are two the most frequent manifestations. They're often early warning signs of cancer. And these are due to the cancer, but also the side effects of cancer treatment. Paraneoplastic syndromes. These are when we have additional problems associated with production of hormones or hormone-like proteins by cancer cells. As I mentioned previously, sometimes lung tumors might secrete ADH, and that can result in the syndrome of inappropriate ADH syndrome. Some lung tumors also secrete ACTH that can result in Cushing's syndrome. Other cancers can cause the production of parathyroid hormone-related protein, resulting in hypercalcemia. There are also cancer cells that produce proteins that can affect blood clotting and various paraneoplastic neurologic disorders. To see them, you can view Table 7-3. Okay, let's talk about cancer treatment. Surgery is used to diagnose and stage cancer. But as for treatment, surgery can be curative, and this is where we have a well-defined tumor and we can just completely remove it and we're done. Debulking is often used, and this is just to reduce the size of the tumor, and then we'll come in with radiation and or chemotherapy to eliminate it, to treat it. Or surgery could be palliative, and palliative is you're not going to treat the cancer, but you're just going to reduce or relieve the symptoms. Radiation. Radiation can be used as a primary treatment. It can also be used like pre-op or post-op in conjunction with chemotherapy or with chemotherapy and surgery. It may be palliative, just to reduce symptoms. And the, radiation uses, essentially it acts to damage DNA and damage blood supplies, vessels, supplying the tumor. And how it does this is it affects rapidly dividing cells. Problem is, it doesn't only affect rapidly dividing cancer cells, it affects all rapidly dividing cells. And this would include the bone marrow, okay, which is constantly generating new blood cells. And this can result in decreased white blood cells, decreased erythrocytes, and decreased platelets. It can also cause epithelial cell damage, and that can lead to damage to skin and hair loss, nausea and vomiting. And it can cause fatigue and lethargy. Chemotherapy is where we use cytotoxic drugs that target various places or various cell machinery or metabolic pathways that are important for cell growth and replication. Usually it uses like a cocktail of multiple agents that can target different parts of the cell cycle. One thing about chemotherapy is it acts systemically, or it acts body-wide. Adverse effects is it attacks like radiation, although radiation is more localized. Chemotherapy attacks all rapidly dividing cells, so this can result in bone marrow depression, which can lead to anemia and the symptoms associated with that. Neutropenia, so that's production of the decreased production of neutrophils, and in general all white blood cells, and this can lead to a big increase the risk of infection, and that could lead to death due to severe infection. Thrombocytopenia would be decreased numbers of platelets, and that can lead to bleeding. So we see anorexia, nausea, and vomiting, and this can due to stimulation of the vomiting center, but it can also damage the epithelial cells of the GI tract. It can lead to hair loss, a decreased sperm count, or changes in menstrual flow, and it can also damage if a mother was pregnant with a baby, it can cause birth defects. A few other types of cancer treatments, we could use hormone or anti-hormone therapy, and this is going to work or act on hormone responsive tumors. Biotherapy, we have vaccines for the prevention of some cancers such as HPV. We can use active immunotherapy. BCG is an attenuated bovine tuberculosis bacterium, and this has been used, actually was used successfully in my father to treat bladder cancer. He continually had bladder cancer. He'd get it removed and it would grow back, he'd get it removed and it would grow back. Well, the third time they injected BCG into the bladder, and bladder just the BCG essentially woke up the immune system. That's kind of how it's supposed to work. And then that would kind of alert not only the immune system of the tuberculum bacteria finding there, but kind of woke it up, if you will, to alert it to the cancerous cells there. Once my dad had that treatment, the cancer never grew back. Various cytokines can initiate or augment the host immune response, and then therapeutic antibodies to target specific tumor genes. You can also use anti-angiogenesis therapy. So angiogenesis is the development of new blood vessels. So in order for cancer to grow, it's going to have to establish a blood supply, and we can give drugs to inhibit the formation of that blood supply. Okay, that's it for topic 1. Please spend some time reviewing the rest of the slides and reading all the notes. Once again, I didn't go over every slide. You should be working on filling in your study guide from topic 1. And in the study guides, pay particular attention to any tables that you might find. That's all for now. We'll see you for topic 2.